The overdiagnosis of attention deficit hyperactivity disorder, ADHD, in children is a stark example of how the medicalization of behavior, when influenced by pharmaceutical interests and institutional pressures, can spiral into a widespread societal shift, redefining normal childhood traits as disorders in need of medication. In recent decades, what began as a legitimate effort to help children struggling with focus and impulsivity has evolved into a system where millions of children are routinely labeled as neurologically disordered and prescribed powerful stimulants. The consequences of this trend are far-reaching, affecting education, parenting, mental health, and the very definition of what constitutes normal childhood development. Behind it all lies an industry that profited handsomely from blurring the lines between medical need and behavioral variation, turning drugs like Adderall and Vyvanse into pharmaceutical blockbusters. ADHD is a real condition, and for some children, particularly those with severe symptoms, appropriate diagnosis and treatment, including behavioral interventions and, in some cases, medication, can be life-changing. But over time, the diagnostic criteria for ADHD broadened dramatically, and so did the public's and the medical community's threshold for concern. Energetic, imaginative, inattentive, or impulsive behaviors, once considered part of the normal spectrum of childhood, were increasingly seen through a clinical lens. Teachers, under pressure to manage large classrooms and maintain standardized test scores, began to refer more students for evaluation. Parents, worried about their child's future and often lacking access to non-drug support options, turned to medication as a way to even the playing field. And physicians, inundated with pharmaceutical messaging and often pressed for time, wrote prescriptions with growing frequency. This explosion in diagnoses did not occur in a vacuum. The pharmaceutical industry played a central role in shaping public perception, medical practice, and even cultural expectations. Drug companies poured resources into awareness campaigns that framed ADHD as underdiagnosed and undertreated. They funded research, educational materials, advocacy organizations, and professional conferences that emphasized the benefits of pharmacological treatment while downplaying the risks. The language of these campaigns was carefully constructed to be reassuring. ADHD wasn't a parenting failure, and it wasn't the child's fault. It was a treatable chemical imbalance. And what was the treatment? A pill that promised focus, discipline, and academic improvement. The rise of Adderall, a mixed amphetamine salt, and later Vyvanse, a long-acting stimulant, marked a new era in ADHD treatment. These drugs were marketed not just to clinicians but to the public, often with narratives that implied dramatic academic and behavioral improvements. What was less publicized were the side effects: insomnia, appetite suppression, mood swings, anxiety, cardiovascular issues, and, in some cases, dependence or abuse. Stimulants affect dopamine pathways and can enhance cognitive performance in the short term, not just in children with ADHD, but in virtually anyone, which made them particularly attractive not only to patients, but also to overworked students and pressured parents seeking a competitive edge. As prescriptions surged, the age at diagnosis dropped, and the rate of diagnosis increased dramatically, especially in the United States. By some estimates, more than 10% of American children and as many as 20% of teenage boys have been diagnosed with ADHD. International comparisons reveal just how extreme this trend is. Countries with different educational structures and cultural attitudes report far lower rates. This raises a troubling question. Are American children inherently more disordered, or has a system evolved that incentivizes diagnosis and medication over patience, structure, and individualized support? There are structural incentives at play that reinforce overdiagnosis. In some educational systems, an ADHD diagnosis can lead to extra time on tests, access to individualized education plans, or even increased school funding. Parents, rightly concerned about their child's ability to succeed, may feel immense pressure to pursue a diagnosis, not out of manipulation, but as a rational response to an unforgiving system. Doctors, meanwhile, are often navigating complex cases with little time, limited behavioral resources, and patient families who expect results. In such a context, a prescription can seem like the most immediate, actionable solution. But the long-term costs are sobering. When children are labeled with a psychiatric diagnosis early in life, it can shape their identity, self-esteem, and educational trajectory. Some may experience benefits from treatment, but others are medicated unnecessarily, exposed to pharmaceutical side effects without a clear clinical need. And as stimulant prescriptions have expanded, so too has misuse. College campuses now report widespread non-prescribed use of ADHD drugs by students seeking to enhance academic performance, a practice that blurs the line between therapy and performance enhancement and raises ethical, legal, and safety concerns. Even more concerning is that the expansion of ADHD diagnoses and stimulant use may be concealing deeper societal issues, such as rigid school environments, lack of play and physical activity, over-standardized curricula, and inadequate mental health support. Instead of addressing the systemic contributors to behavioral difficulties in children, society has opted for a biochemical solution. The result is not just an over-medicated generation, but a culture that pathologizes childhood traits like curiosity, restlessness, and spontaneity, qualities that may be challenging in a classroom, but are essential to creativity, resilience, and emotional development. In retrospect, the overdiagnosis of ADHD is less a scandal of deliberate fraud than a slow-moving catastrophe of misaligned incentives, incomplete science, and well-intentioned shortcuts. The pharmaceutical industry's role in this process, though rarely criminal, was instrumental in crafting a narrative that turned millions of children into lifelong patients, often without sufficient regard for long-term consequences. Drugs like Adderall and Vyvanse did not succeed simply because they worked, but because they were sold as the only viable answer to a problem society was unwilling to solve any other way. The most dangerous myths are not those that outright lie, but those that contain enough truth to disarm skepticism. ADHD exists, and stimulant medications can help. But when normal childhood behavior is medicalized on an industrial scale, and when financial interests shape the very definition of disorder, we risk losing sight of what health, development, and childhood truly mean. And in doing so, we allow profit, not wisdom, patience, or care, to define our collective future.